Good morning, everyone. I know that a few folks are probably still trying to get into the session. We have over 300 people registered for the session, and so it's a real pleasure for me to welcome all of you. My name is Dr. Vic Kapil. I'm the Chief Medical Officer and the Associate Director for Science from the Centers for Disease Control at the Center for Global Health. So I would like to welcome you on behalf of the organizers and thank the organizers for inviting me. I will be moderating the first part of this session, and the session is focused on the PHI CDC Global Health Fellowship, as well as the Sustainable Technical Analytic Resources Project, the STAR project, hosted by USAID. So it's my distinct pleasure to join all of you and participate in this session. This is an area of great interest for all of us, as well as for the organizations that are engaged. And I do hope that all of you participating will find this a useful session that will help you not only with the work that you might be engaged in, but also for those who are contemplating a future career in global health. First, we will have brief recorded presentations from 4 panelists, and I will introduce them shortly. Following that, we will have a brief question and answer session live with them, in which they will take questions. And then we will have a brief break, 5 to 10 minutes. Following that break, there will be a second program session, which will be moderated by my colleague, Mike Sage. If you could go back one slide, please. And Mike will take that second session, and he will introduce the panelists for that session, and where there will be further opportunity for questions and answers specifically about the programs themselves and about the organization of the programs. So the objectives for the session we have identified are, number one, for the panelists to share their experiences and the lessons that they have learned in their work, the learning to help guide future public health professionals in their activities, particularly related to response. Much of this past year's activities for many of these folks have been focused on response because of the global pandemic. And then how the pivot to the globally to COVID activities will better inform and prepare the global health workforce. So our panelists are Courtney Shirata, who's an epidemiology fellow with CDC, with the PHI CDC Global Health Fellowship Program. Dr. Ghulam Kader, who's the senior TB advisor in Afghanistan with the STAR project. Mohammed Kibriya, who's the senior TB strategic planning advisor in Bangladesh, also with the STAR project. And John Jaramillo, who's a surveillance and fellowship alum from the PHI CDC Global Health Fellowship Program, currently working on activities related to some of the work that he did in Guatemala. So it's my pleasure, and without further ado, I'm going to now turn it over to the staff, who will first play a recorded video with each of these individuals, talking a little bit about their experiences, and then we'll open it up afterwards to live Q&A with the panelists. So could we start the video, please?
Hello, good morning. I wanted to start by thanking CUGH for this opportunity to share my story. So to briefly introduce myself, my name is Courtney Sharada, and I'm a second-year Global Epidemiology Fellow in the Public Health Institute CDC Fellowship Program on the Global Immunization Safety Team of the Center for Global Health. Next slide. For the past year and a half, I've had the pleasure to work with this team on a variety of projects, from a fractional yellow fever vaccine clinical trial, a health provider survey on immunization services with the American Academy of Pediatrics in Nigeria and Indonesia, the preparation of a regional adverse events following immunization, or AEFI, surveillance system for the Americas with the Pan American Health Organization, development of a COVID-19 vaccine dashboard identifying target populations for phase 1 of vaccinations, and a Brighton collaboration working group called Digital Innovations in Vaccine Safety that's aimed at creating a mobile app to track adverse events following the COVID-19 vaccinations in healthcare workers, among others. As you may see, the amount of work I have certainly hasn't decreased from telework, but in fact has only increased. However, the nature in which I communicate with my colleagues, complete my work, and even how I find motivation has changed. Today, I'd like to share this experience with all of you in hopes that it inspires fellow global health colleagues to reflect on their own experiences and lessons learned from this unforeseen time. Next slide. Now I want to briefly paint a picture of the before and after of my fellowship during COVID-19. Before, in the first 6 months of my fellowship, I would get up at 6:30 a.m., put on business casual attire, sit in the inevitable Atlanta traffic, and show up to my office cubicle for a typical 8 to 5 day full of ad hoc meetings, daily tasks, lunch with colleagues, presentations, and even 1 hour French lessons. With this day-to-day came the fast-paced nature of a global health office, constant updates, new opportunities, and of course, travel. In just 6 months, I had traveled to Santiago, Chile for a regional meeting, Washington, D.C. twice, once for vaccinology training, and again for a meeting at the PAHO headquarters, and finally to Kampala, Uganda for data collection for one of my projects. So the photos you're seeing now are from the PAHO headquarters to the left, and my last tour of duty in Uganda with the clinical trial team to the right. It was there in Kampala that I got wind of the US's decision to shut its borders and begin the new age of quarantine and social distancing. So within 24 hours, I was told we would be cutting our tour of duty short and would be returning to on the soonest flight back home. Next slide, please. Around the same time, my twin sister, also a fellow in the fellowship cohort, was told she would be leaving her current post in CDC Zambia to return to Atlanta indefinitely. So as you'll see in the now photos, the left is my sister Alexis working from my garden in Atlanta, and a new typical meeting on MS Teams to the right. Well, to be quite frank, I didn't realize how big of a turning point this time would be. I was hopeful we would control the pandemic quickly and telework would be temporary. I'm sure most of us thought this at the time, but as we all know, that was not the case and reality set in. I started to get restless and to lose motivation, and I knew I had to make a change. That is when I decided that I needed to be an active part of the COVID-19 response, and I found a 2-month detail position with the Epidemiology Task Force. Next slide, please. During this time, my responsibilities included calling English and Spanish speakers that had suffered from a recent COVID infection to collect demographics, recent exposures, symptom history, and comorbidities. I spoke with well over 100 people during this time, and many of the calls lasted 30 to 45 minutes as people shared their personal experiences. And slowly, I noticed the stark difference of health outcomes in minority populations, and it shook me. The health disparities we have all seen in data, read about, even had personal experience with, was worsening. With this, I found a newfound motivation. I was reminded that these numbers we stare at every day are living, breathing people, and they want to be heard. From this experience, I went on to take a certification course in Spanish medical interpreting in hopes of being a continued voice for marginalized populations. Next slide, please. Now, skipping ahead to present day, what we define as global work has changed. The new normal includes conference calls and sharing of live documents with colleagues around the globe, as you can see in the map that represents just a few locations of my colleagues. We've had to be creative with these meetings as a means to brainstorm, work together, and push forward urgent requests for support in the new version of in-person. In my personal experience, we have incorporated using video in nearly all of my meetings as a way to connect more personally and understand each other's perspectives more clearly. Most start with 5 to 10 minute check-ins about our personal lives, families, and struggles as a new form of professionalism. Next slide, please. And my professional tactics have evolved. Networking has become sending that cold email, reaching out to colleagues of colleagues, asking that burning question you have on a video call, and connecting with colleagues in online trainings virtually. Professional development has shifted from in-person trainings to taking more independent projects from your team and taking initiative when the new time-sensitive tasks arise. It is reading that educational book in your free time, listening to that podcast in a new language, and making time in the evenings to complete online courses. But even more so, it's learning your limits in your professional life, recognizing when you are taking on too much, being able to say no, and taking time for yourself. Getting outside for fresh air to clear your mind, talking to friends and family, being intentional with your time, whatever that looks like for you. Finding that renewed sense of purpose in your day and finally doing things that you love. Next slide, please. And finally, I want to end on a positive note. With every difficult time comes a silver lining. So I ask, how can we change the narrative of the impact of the COVID-19 pandemic on our global careers? For me, I think our silver lining is data innovation. These technologies, young and old, have truly stepped into the light and are bringing us together professionally in ways we hadn't even thought possible a year ago. We are able to make predictions about future infectious disease outbreaks with mathematical modeling that can be shared publicly on interactive dashboards. We are utilizing social media platforms to encourage conscious health behaviors like double masking and to deliver new near real-time updates on community transmission of COVID, making previously paper-based surveillance systems into active electronic systems, and finally using mobile apps to collect adverse event data post-COVID vaccination so that experts are able to respond to serious events more rapidly, saving lives and maintaining confidence in the vaccine campaigns. When pulling expertise from around the world, it's truly amazing what we can accomplish in such a short time. And I think it's crucial to keep that mindset as we head into the second year of this pandemic. Better times are upon us, and as cliche as it is to say, we are all in this together. Last slide, please. Finally, I want to say thank you to PHI, my CDC team, my international colleagues, and those close to me that have truly helped me make the best of these times. Thank you.
Hi, everyone. My name is John Jaramillo. It is an honor to be here with you today. Next slide, please. I'd like to start this presentation with a little bit about me. I was born in Medellin, Colombia, and I immigrated to the US with my parents and older brother at the age of 2 years old. I have a bachelor's degree in human rights studies and an MPH in global health. I see myself being part of different communities that I identify with, including Latinx, immigrant, LGBTQ+, communities of color. Next slide, please. So before the pandemic, I was working on developing CDC's communication strategy at their Central America regional office located in Guatemala City. There, I developed stories, fact sheets, and other materials that showcase the great work of my colleagues. I also managed disease surveillance projects in Honduras and the Dominican Republic, and helped the office generate more research publications on priority disease areas such as rabies, Rickettsia felis, and acute febrile illnesses. At the height of the pandemic, I was reassigned to Kansas under CDC's Emergency Operation Center's Global Migration Task Force, and later the International Task Force. I relocated to Atlanta with only a few days of anticipation, one bag, and unsure of what the next few months would bring. Next slide, please. As a fellow, I went from working at an office space to working 100% remotely. This was particularly difficult for me because I was accustomed to daily face-to-face interactions with my team and with working with them more hands-on on most of the projects and calls that we were on. As an extrovert, I had to readjust my work style and come up with new ways to interact meaningfully with my team. Moving around and finding a place to stay in Atlanta during the middle of a pandemic was also really quite challenging. Next slide, please. During my first detail in June, I was temporarily deployed to support COVID-19 response in Southwest Kansas, and this was done remotely from Atlanta. My specific work centered around a small community of meatpacking workers, some of whom were Latin American, Southeast Asian, and African immigrants or refugees. I was tasked with understanding or trying to understand perceptions of COVID-19 and community communication preferences. And I did that through interviews with community leaders and employees. And with that, I was able to develop a report with my team as a second author. Through the research that I conducted, we found that according to community leaders, misconceptions persisted about asymptomatic or mild disease, the meaning of isolation and quarantine, and what to do while awaiting test results. This represented for us opportunities for public health engagement. The findings also suggested that structural supports were necessary to ensure that individuals could protect themselves at home, in the community, and at their place of employment. In addition, we asked really interesting questions about how people would prefer to receive information. And what we learned is that in order for us to improve COVID-19 message dissemination and trust between public health and multicultural communities, diverse channels could be used to share COVID-19 information, particularly in preferred languages and in plain language. When thinking about this opportunity, I think one of the most important things I learned here was how much work still needs to be done in service of diverse communities. Even when resources are provided, there is no guarantee that people will use them if their identity and cultural norms are not taken into account. Public health agencies like CDC still have a lot to learn about how to fully engage or provide support to communities of color, whether that's linguistic support, culturally sensitive messaging, or tailored care. Next slide, please. In November, I joined another team under the International Task Force. As an information manager with the country support team, I was tasked with managing and disseminating important information to all CDC country offices around the globe. This was really cool because it allowed me to really collect and search and scan for news, articles, updates, and current research pertaining to priority topic areas, such as surveillance, lab and diagnostics, and vaccine preparedness. So these were the hot topics, or are still the hot topics currently with regards to COVID-19. And what this experience provided me was yet another perspective about CDC's COVID-19 response, but overseas, and how CDC country offices around the world were being supported. This role allowed me to see how important it was to provide leaders and subject matter experts with the most up-to-date resources in order to assist them and their teams in response planning and decision-making. I was also able to network and make meaningful connections with other CDC staff and show them who I was and what my work ethic was as well. Next slide, please. So throughout this fellowship year, I was able to acquire different skills and reflect on life lessons gained from this experience. Firstly, I developed my ability to adapt to a fully digital environment. So this required me becoming more comfortable with email and other communication platforms like Teams, Skype, and Zoom. I also didn't have any excuse for being late to meetings. And so I think that my time management also really got better because of this. My social and emotional intelligence was also positively impacted. I no longer had access to visual social cues or body language as a way to interpret how my team members were doing. And so I began to pay more attention to people's tone, their body language, and their tone and their ability to be able to do more check-ins with me and sort of be able to have those opportunities to see how each other were doing, but virtually this time. I also developed new research skills as I learned how to conduct research remotely in an ethical and a systematic manner. And this required reimagining methodology and the vision for our future projects. I think the lessons I will carry with me moving forward in my career will be to say yes as much as I can and as much as I'm comfortable with. Doing this during this fellowship year, it allowed me to do work that I was not particularly comfortable with and was not within my area of expertise, but it helped me immensely in gaining additional experience in other areas of public health, while also networking with really smart and capable people. This was also in line with continuing to be flexible and comfortable with discomfort. My interests particularly lie in HIV prevention work and qualitative research. But my flexibility allowed me to develop the vocabulary and the work experience in the areas of surveillance, epidemiology, and laboratory. And I began to feel empowered when joining meetings with epi or lab experts and felt confident when I could speak their lingo and understand what they were talking about. Lastly, I learned to advocate for time off and not feel guilty about it, ensuring that I was doing what I could to stay healthy and to be emotionally and mentally healthy as well. Next slide, please. So since this fellowship was a professional development training program for early career professionals, due to travel restrictions, I couldn't attend any trainings, nor did I have the time to look for online trainings. I had to get creative with how I could continue to grow professionally. I became more intentional about investing with the people around me and in my colleagues. Before COVID, I also tended to apply a lot of pressure on myself about where the fellowship would take me 5 to 10 years down the line. And I learned to just let go of that sense of control. Letting go of that control and the unrealistic expectations that I had for myself allowed me to enjoy the journey that I was on and focus more of my energy on developing the skills that would be translatable in any type of position in the future, whether it was another job position or in academia as a researcher. I also became more people-focused, learning what I could from others and appreciating their journeys as well. Next slide, please. Before closing, I'd like to end with the following thoughts. As a fellow with CDC, it's been a whirlwind of a year, and I'm surprised at all that I accomplished and all that I did within such a short period of time. Although the work never stops and I'm still processing it all, I look towards the communities that I'm a part of. There's still so much more to be done for racial and minority groups that are impacted by COVID-19. And I'm reminded by my uncle who recently passed away from COVID. I honor his memory and I'm more empowered than ever to work in service of communities. There is a place for me in public health, and there's a place for each one of us that wants to make a positive contribution to the communities we belong to. I'd like to thank my mentors as well for their support and encourage those who are working in public health to build community, to be intentional about investing in people, and to create spaces for our identities and lived experiences to be understood, to be valued, and to be appreciated. Surviving this pandemic is a shared experience, and human connection is more important than ever. Being able to nurture resilience and joy with colleagues who may be experiencing loss or hardship, and creating those opportunities to really talk to them just beyond work, and to update each other and to be able to check in can really make a difference. Thank you so much.
Thank you, and hello everybody. Thank you for the CU Global Health and also STAR project for having me to present my experience of work during the COVID-19 pandemic. Next slide, please. I have been working as a STAR fellow, as a senior TB advisor for the National TB Control Program of Afghanistan. I have been working for STAR since February 2000, and just the time when the World Health Organization announced the COVID-19 as a global emergency, and they asked the countries to be prepared for this pandemic. Next slide, please. Well, Afghanistan is a landlocked country. It shares border with the Central Asian countries, and also with in the south with the Pakistan, and in the west with Iran. We have 37 million population based on the UN estimates, and also we have some around 5 million population that as a refugees in Pakistan and in Iran. And so far, as per the WHO, the website, 55,580 COVID-19 cases was reported by the Ministry of Public Health of Afghanistan, and so far around 2,400 Afghans died owing to COVID-19. The pandemic, the first case was reported by the Minister of Health in 28th of February 2020. As you see in the graph, we had the peak during the May, June, and also July. Then it declined, and the second wave we also passed, that was peaked in November and December. And meanwhile, the Ministry of Public Health has conducted a seroprevalence survey in August 2020, and they estimate that around 10 million Afghans were exposed to the COVID-19, SARS coronavirus 2, because this 10 million people has shown the antibodies against this SARS coronavirus 2. Next slide, please. This assessment, this study shows that the children were less likely to be affected by the COVID-19 compared to the older ones, and men were less likely to be affected compared to women in country. Next slide, please. Yeah, the COVID-19 impact on the work during July and June 2020, we are work from home order, and in April, the two cities, that Kabul and also Herat in the west, they were in total quarantine. Herat shared border with Iran, and majority of the Afghan refugees began returning in a mass form from Iran when the Iran reported the first COVID-19 case in April last year. So the country was faced with the challenge to manage this hundreds of thousands of refugees that returning, fleeing Iran and back to Afghanistan. And later in July and August, there was a alternate day we were attending office, and full attendance to the office was started in September 2020. It continued so far. Most of the management and meetings were online and through virtual forums like Zoom meeting, Google meeting, and so on. And interestingly, the Green Light Committee they conducted a virtual assessment of the laboratory system in Afghanistan this year. They are conducting this assessment each year, and they were physically present in the country, but this year they managed to do it virtually, and the STAR was one of the partners assisted them in accomplishment of this activity. Next, please. Work related COVID-19 activities that I were engaged. I was picked by the Ministry of Health to assess them on the contact screening of the COVID-19 patient. So using the contact investigation of the tuberculosis, so they picked me. I was managing and leading the National Contact Screening Committee at the Ministry of Health, providing them leadership on how to do using this TB contact investigation practices. In addition to that, I still a member of the Science, Epidemiology and Research Committee of the Ministry of Health. This was one of the committees that established last year, and the task of this committee is to provide the literature around the world and provide the evidences to the leadership of the Ministry of Health on how to plan to tackle the pandemic. In addition to that, as COVID-19 pandemic affected a lot of health service activities, including the TB activities, and as per our estimates, it shows that this year there will be 10% less cases notified compared to previous year. And in order to reduce the impact of the COVID-19, I managed to develop a policy brief on reducing impact of COVID-19 on TB, and this was passed through the Science, Epidemiology and Research Committee and was signed by the Minister of Health and implemented to reduce this impact. In addition to that, I was given a task to develop a strategy for Minister of Health to use the GeneXpert technology to diagnose COVID-19. So this strategy was developed, and the Minister of Health received 5,000 tests, and they are using that strategy so far and diagnosing this COVID-19 using the GeneXpert technology. In addition to that, I facilitated the ventilators that was donated by the USAID mission in Kabul, Afghanistan to the Ministry of Health. Next slide, please. Yes, skills and lesson learned. The leaders' skills such as the mentoring, coaching, and feedback, and also emotional intelligence was very important during the pandemic to other colleagues and also the STAR fellows. So we were managed to be in contact with them through using this digital technology every day, and also other colleagues from the National TB Control Program. So one of the lessons that I learned that this task was so important to have the task accomplished, and also to reduce the impact of the pandemic on the health activities, including the TB. In addition to that, we were engaged with in strategy decision-making process with the NTP and also the Ministry of Health. As some of them, as I already illustrated, such as the development of the guidelines and also standard operation procedures for the contact investigation of the COVID-19, and providing them the up-to-date evidences through the Science, Epidemiology and Research Committee, both to the TB program and also to the leadership at the Ministry of Health to take decision to reduce the impact of the COVID-19 on the people as well as on the health service delivery. In addition to that, working in crisis situation and crisis management, this was one of the biggest challenge for all the healthcare staff in a country like Afghanistan, where it was never ready to tackle this pandemic. Next slide, please. Well, future plan and the task that will be accomplished, the recommendation is as planning for tackling the large outbreaks and pandemics. This should be planned ahead, and this was one of the lessons that we faced with this challenge, and we weren't able to tackle it well. In addition to that, working in crisis situation and crisis management, this was one of the biggest challenge for all the healthcare staff in a country like Afghanistan, where it was never ready to tackle this pandemic. Next slide, please. Well, for the future plan and the task that will be accomplished, the recommendation is as planning for tackling the large outbreaks and pandemics. This should be planned ahead, and this was one of the lessons that we faced with this challenge, and we weren't able to tackle it well. As you know that in study that Ministry of Health conducted, around 31% of the Afghans were exposed to the SARS-CoV-2 virus. So that was a large portion of the population that got infected. So there was a lot of deaths, and also the hospital weren't able to manage them. In addition to that, the increased health system capacity, such as human resources, equipment, and strategic storage to tackle our large outbreaks or the pandemics, and the human capacity to manage the emergency of infectious disease. This is one of the areas that needs to be strengthened within the government of Afghanistan. And also strengthening surveillance capacity, use of digital technology in recording and reporting that will make it very easy to properly communicate with the people, and also to use the data for planning and strategic decision. In addition to that, I recommend that the government should have the IHR capacity, the international human regulatory capacity within country to able to address the outbreaks and also the pandemics. And also management of the infodemic. This was one of the challenge that that a lot of the people, the messages that distributed among the people that they were practicing or they were getting the information through the social media that weren't fact, but they were just the myths.
Hello, everyone. Thanks for having me here. I would appreciate the PHA CDC and USAID Global Health Research Fellowship projects for giving me the opportunity to talk in this Saturday session. My name is Mohammad Ghulam Kibriya, and I am working as Senior TB Strategic Planning Technical Advisor on the STAR Fellowship project. I began working here a little over 1 year ago, and I'm based in the National Tuberculosis Program in Dhaka, Bangladesh. And my day-to-day activities include having the coordination between the USAID implementing partners and the National Tuberculosis Program to the development, rollout, and maintenance and sustainability of existing USAID-supported health information systems. I also provide technical assistance to ensure routine TB data collection system is in place, and I also analyze the epidemiological data on periodic basis to monitor the progress and gaps. I also assist NTP to design and implement a performance monitoring plan for TB operation plan and provide technical support during the annual program performance review. And I also build human capacity on health informatics through on-the-job training and mentoring to the NTP staff. Next, please. A little background information about Bangladesh. Bangladesh is a country in Southeast Asia region. It is the 8th most populous country in the world, with a population exceeding 165 million. The COVID pandemic was confirmed to have spread to Bangladesh March in 2020. The first 3 known cases were reported on 7th March 2020 by the country's Epidemiology Institute. Bangladesh saw a steep rise of the infections from April. Cases are distributed throughout the country. Dhaka and Chattogram, especially these are the 2 divisional headquarters, remain as a hot spot. As of today, more than around half a million confirmed cases with a little over 8,000 deaths as today recorded as of today. The case fatality rate still remains less than 1.5%, and the elderly male people was most affected by the COVID due to their comorbidity with other diseases. The Health Department, in collaboration with other ministries, prioritizes the development of country preparedness and response plan just after the COVID has hit the country. And the government has collaborated with WHO, USAID, and other bilateral development partners, and also involved the expanded program on immunization to work together on the COVID programs, especially to combat the COVID and also to lead the vaccination program. Bangladesh rolls out its nationwide COVID-19 vaccine campaign from Friday, 7, 2021. And as of 15 February, approximately 1 million people are vaccinated. And you see on the graph that Bangladesh COVID cases is getting actually lower and lower day by day, and the growth rate is less than 1.0. So we can see that Bangladesh somehow managed to curb the COVID infections. And you see that the vaccination program has started, and people are very much enthusiastic to get vaccinated. Next slide, please. There are many lessons I have learned after the COVID. The first one, from professional perspective, I understand health system resiliency needs to be revisited. Whether the system being able to adapt is functioning to absorb a shock or transform, if necessary to recover from the disasters, it needs to be critically reviewed. Probably an improved and resilience relevant matrix may be needed. As I had to work with NTP and USAID remotely, and also the USAID implementing partners in tandem, hence providing day-to-day update periodic calls with USAID was important to ensure that we are all same page with our work and deliverables. So I believe that time to time updates and information on ways of working sustain credibility and trust among the USAID government and also the USAID implementing partners. From the from personal perspective, I also, as I said earlier, that it is a challenge to have a better work-life balance, juggling with own workload with parenting children and who would be normally in the school. So work-life balance is more important than ever. So I mean, at that same time, I understand that it is critical for the organization to address the risk of burnout of its staff. Next slide, please. On top of the regular TV activities, I had the opportunity to work with an NTP to do some COVID-related activities. So it was an exciting work because of this is a new work which actually attracted me a lot. So I started to contribute the preparation of an integrated funding proposal that is the disease include TB, HIV, and malaria for the global fund for COVID-19. So it is a funding proposal from the proposal request from the global fund, which NTP National Tuberculosis Program led the process, and I, along with 2 NTP colleagues, to develop the proposal and submit it to the global fund, which eventually was approved. Following that, I also worked to develop the monitoring and evaluation plan for this COVID-19 response mechanism project. At the same time, I analyzed the impact of COVID-19 on the TB program, which, I mean, we have seen that the number of cases has drastically reduced during the COVID. So is the program. So has been disrupted. So based on the request of the NTP line director, I analyzed the missing case analysis at the subnational level, and that assisted NTP to devise a catch-up plan. And I developed GIS mapping and some modeling to guide NTP to make evidence-based decision making. I also had the opportunity to collaborate with USAID's Data for Impact project that is being implemented by University of North Carolina at Chapel Hill to estimate the effect to COVID-19 on utilization of health services in Bangladesh. Next slide, please. Next slide, please. On a personal level, during the COVID period, I have developed this surveillance dashboard, COVID surveillance dashboard, with one of my colleague. And this dashboard was critical for the country, so that the country can access to the data on real-time basis and see what is happening throughout the country. And it is a global dashboard, and we collected data from Johns Hopkins University research database and perform a series of data analytics and spatial analysis to provide summary of graphs and maps, and that replaces daily, which is adapted at showing country to country data. It's also encouraging to see that STAR posted this update to its website. Next slide, please. This is important actually, matching with the fellowship expectation. I believe this fellowship is instrumental to enhance my data analysis skill, as NTP has given the access to their routine data. So it shows that the trust on me. So I have been able to not only analyze the TB data, but also HIV, malaria, and leprosy data, because of NTP manages all those programs together. And I also have the opportunity to improve my technical writing skill, as I was involved in writing many proposals and technical reports or disease burden analysis, and expand my programmatic knowledge beyond the TB field. So as I said earlier, I have got some interaction with malaria, leprosy, and TB colleagues, HIV colleagues. Although day-to-day work changed that lead to less interaction with and technical discussion with colleagues, that was a challenge. But achieving the deliverable has not been changed. So although the deliverables remain same, but with the less interaction with colleagues, it actually hampers sometimes I feel that the quality of the work. And also, please go back last slide. Yeah, and also less field trip, and that hampers learning from the field too. So as you know, the field restriction was there, so I have not been able to go anywhere till now. So that has also hampered the learning from the field. Next slide, please. What the future holds us actually. I believe that it will be a little bit changed during the post-COVID era. However, it seems like that a hybrid model is likely to emerge that will try to balance the efficiencies gained by remote work and also the benefit in person when we interact with other colleagues that sparks innovation. I also believe that more public health related opportunities emerge, especially infectious disease control. And as you see that there is a gender disparity in the public health program. So I believe that giving employees more flexibility in choosing when and where they work, that can increase gender equality. I mean, via two pathways. First, remote work can help mothers better balance their work and family responsibilities, and which makes them less likely to sacrifice one for the another. And second, I think as father will be more involved in the family responsibilities, that may help the mother to work in the public or health on other fields. So I think that would be a good opportunity to see more women in this field. And finally, I believe the digital future will push us to embrace new technology. to acquire new skills or up skills, especially like coding, data analytics, and cost-cutting health health system issues, especially leadership, system thinking, decision-making, collaboration, and innovation. I believe these soft skills, we need to be sharpen our skills so that we can actually provide more technical support to the countries, so that countries can actually recover the loss they have, the loss they have faced during the COVID period. And next slide, please. And thank you, everyone. If you have any questions, feel free to ask me. I'll be available here to respond to your questions. And thanks again to PSI, CDC, and USAID Star Fellowship Project to giving me the opportunity to talk about the COVID-19 program. Thank you.
Thank you so much, Mohammed. That was just a fantastic presentation, and I'm sure that all of the participants will join me in congratulating all of our panelists. I think you guys have done a wonderful job summarizing some of your experiences, talking about your learnings, and also talking a little bit about how COVID has impacted your work over the past year. I do believe that Dr. Kader is having some difficulty, some technical difficulties in joining us, and we're still going to continue to try. But in the meantime, I would like to begin some question and answer session at this time. We have plenty of time. I think we have at least 30, 40 minutes for Q&A before we're scheduled to take a break. So could I please ask Courtney, John, and Mohammed, who I know are online and have been able to join, to please join me with your video. And then we have already received some questions, which I will start with. And then if others in the audience have questions, please feel free to type them into the Q&A box, and I will try to sort of moderate and direct the questions to any of our panelists. And as far as the panelists are concerned, please feel free to jump in, just raise your hand or give me a wave or give me a raised hand on your screen, and I will call on you if you'd like to join in answering a question. The first question is really about all three of you, is really about your the expectations of your fellowship. I think this is a question that probably a lot of people who are contemplating a future career in public health and potentially joining a fellowship program are interested in. Could you talk a little bit about what the expectations were of you as fellows? Are there general outcomes outside of project specifics or project-specific outcomes that fellows are aiming to achieve or are expected to achieve? And how do fellows work with CDC and USAID and CDC and USAID institutional partners to work together, and also specifically related to COVID response in the last year or so? So I will open that up to any of the three of you who would like to try to tackle that, and just raise your hand or let me know who'd like to speak first. Courtney, would you like to tackle that one first, perhaps? And then we'll Sure. Go to John and Mohammed. All right.
Okay. Thank you, Vic. Good morning and possibly good afternoon to anyone else who's logged on from other areas of the world. I will just start by saying that I think it's important to recognize where you're placed, because as a fellow, the expectations that come along with a role are going to be very team-based, depending on which team you're assigned to or which team you select in the process of the fellowship. But I also want to make a point to say that it's really about what you make it. And I think it's important to recognize that it can be kind of a 50-50, what is expected of you and what you expect of yourself and of the fellowship. Going into it, it's I think, a good strategy to have an open mind, recognizing it is a learning opportunity, but for a lot of us, it's also the beginning of a career. It's not just professional development. We treat it like a job, and we treat it professionally in that way. So it's kind of a give and take, that you have to remember that you are there to learn, but you're also there to contribute to your team and to CDC and to other programs on a wider basis, and to maintain that mindset in all of your projects that you're representing, not only the fellowship, but CDC, as well as other partner organizations, depending on the types of projects you're involved in. I think for me personally, it started with me recognizing what was expected of me from my team lead, from my mentors, from my team as a whole, and from partner organizations. And then I got to expand on that and be creative with, well, what do I want? What do I want to contribute? How can I best fit into this team and bring an expertise that maybe wasn't already there? As far as COVID related, I will say that it hasn't really changed too much, because I do regularly meet with my mentors and with my team lead, and with my colleagues from partner organizations. So in that way, I wouldn't say COVID has necessarily changed the way that expectations are perceived onto you, or you perceive your own expectations, because it's very much what you make it. I guess a piece of advice I would say is just maintaining that mindset that you had when you were going into the office is, this is a job, this is a professional development opportunity, and to treat it, with that type of professionalism in maintaining meetings, and maintaining your own expectations as well as those for your mentors by regularly checking in, that sort of thing. Sorry, that was a little long-winded, but thank you, Vic.
Great, thank you so much, Courtney. I will note that I believe Dr. Kader has been able to join us, so thank you very much, Dr. Kader, for joining us. I hope you can hear and see us. We do see your name on the screen, so hopefully you are connected. If you can join either by video and or audio, please go ahead and open up so that we can also hear from you. John, Mohammed, or Dr. Kader, do any of the three of you have anything further you'd like to add regarding expectations of fellows and sort of the general outcomes and versus project specifics that you might be expected, that might be part of the expectations of your fellowship program?
Greetings, everybody. Can you hear me now?
Yes, we can hear you loud and clear. Please go ahead, Dr. Kader.
Well, yeah, the expectation has changed as owing to this COVID-19 pandemic began, both from work point of view and also from the workplace. Because sometimes it has changed to the city gone through full quarantine, and the city was locked down, so we were stay at home. However, the Ministry of Health issued me a card that I could show it to the police in the way, so they were giving me a chance to drive to Ministry of Health. Because I was one of the, leading the National Contact Screening Committee for COVID-19, and the reason behind that, this was we have to apply the experience that we got from the contact investigation from TB to apply. So this was one of the task shift. I was fully assigned during since mid of February 2020 up to August 2020 and managing this contact investigation. So during this time, I was mentoring the staff from the national, from the Ministry of Health, so they could manage it now by themselves. And on the beginning, it was of utmost importance to investigate and to find the contacts of our COVID patient so as to contain the spread of the disease. And in addition to that, the science committee, still I am member of that. We were expected to provide the new knowledge that's emerging from around the world on the COVID-19. So share it with the leadership of the Ministry of Health to take actions and to contain the spread of the disease and avoid the deaths at the end. So in addition to that, the 2020 was a busy year for the national TV program because they were developing the concept, the proposal for the Global Fund grants. There was a regular grant and also later the COVID-19 response mechanism grants that also appears in the middle of the peak of the COVID-19. So these were the expectation that has changed. And in addition to that, the NTP offices where we share the office, that was shifted because the NTP office was repurposed for the COVID-19 because it is the adjacent of the communicable disease hospital that was used by for the MDR patient, and that was repurposed for the COVID-19. So for at least 4 months, the building was used by the COVID-19, and also the National Reference Laboratory was locked because of this repurposing, and the MDR patient or drug resistant patient was shifted to other hospital, and the culture and DE and drug sensitivity testing was interrupted. And however, we were for some time we were from work from home, but we were expected, the NTP and also the Minister of Health was expected us to do more than the normal ones, so that we were providing them the new knowledge on how to tackle the COVID-19 and also how to reduce the impact of this pandemic on tuberculosis. Over. Thank you.
Thank you, Dr. Kader. And I suspect you also had a lot of technology challenges, things, lots of changes related to the pandemic, and not dissimilar to what we've experienced today with our meeting. I have a question which I would like to direct perhaps first to John and Mohammed, and then others should also please feel free to jump in. And it has to do, and there's several questions on this, it has to do with working in the team and working with mentors. Could you talk a little bit about, in your fellowship experience, how did working on a team prepare you for your future work and career in public health, and specifically how you worked with your mentor or mentors, and how you continue to perhaps keep in touch with the mentors from your fellowship program in the work that you're currently involved in. So the work is about teamwork, and then also about the mentor-mentee relationship, which is, I think, very important in these kinds of experiences. John, would you like to tackle that one first, and then maybe Mohammed? And then Mohammed, we have a specific question for you as well about Bangladesh, which we'll get to in a little bit, but let's talk a little bit about the mentor-mentee relationship first. Thank you. John?
Sure, thank you very much. I will take a stab at this. I have a unique position with my experience because as a
Latino US citizen working overseas in a Spanish-speaking country, part of my identity was shared with my team. And so within my team, I also had US citizen, bilingual Spanish-speaking Latinos, or other individuals that also shared a similar culture. And so I think that really helped us to connect across not only professionally, but personally, based on these shared identities, which allowed us to just get very much closer with each other and be able to figure out how we all fit within that team, which based on my previous experiences, I've never had that experience before. And so it really opened me up to seeing how that could work, and how possessing similar identities within a team could really work to create that cohesion and that shared understanding of how to get the job done. With regards to mentorship, I was also very lucky because I got a mentor that was really invested in my professional development. And so that allowed me to annoy her as much as I could with regards to paperwork that I perhaps needed signed or being assigned to specific projects or tasks. We were able to develop that mentor-mentee relationship to the point where we had the trust developed where I could ask to be placed on certain projects or do certain type of work. Once that trust was established, once she was aware of my my skill set, my work ethic, which takes a lot of time. And so I think that's a great question to ask, because not only is this a fellowship for you to grow professionally by gaining experience based on what projects you're assigned and that you work on independently and as part of a team, but also a lot of it is interpersonal. A lot of it is based on these shared experiences with your team and networking with the people that could advocate for you later down the line when perhaps you might be looking for a job or you might benefit from an excellent recommendation from them. So those steps that you take along the way with regards to ensuring that you have a great relationship with your mentor, that you do what you need to do with regards to what expectations they have from you, and outlining those in a way that it is clear, it is transparent what the expectations are that they have from you and what you have from them. Because sometimes as mentees, we do forget that mentors also have a responsibility and a duty to exercise an exceptional mentorship upon us, and that we should be empowered to demand it professionally and in a nice way, but to be empowered to say, hey, I need X, Y, and Z by a certain date, given that this is the plan that we had. And I'm sorry, I know that you're very busy, but this is what we had discussed. So not being shy to continue to monitor that, to speak up for yourself, and to ensure that not only are you doing your part, but that your mentor, who is very busy, is also doing their part and being comfortable with making them uncomfortable when you need something from them. So that's just based on my experiences, and I hope that helps a bit. Over.
Excellent. Thank you. Dr. Mohammed,
Yeah.
or Mohammed Kibriya, please.
Yeah, I mean, thanks. That's a great question, actually. I mean, I'll take on the gym work part, actually. So I'm based in the NTP office, and the office was open throughout the lockdown period too. So, I mean, we had to work from home for a few months. Then I got back to office because all other government office colleagues are working from NTP office. And the collaboration was key, although that year was extremely busy for me. And so the learning part is a little bit challenging as I am delivering all the time. I have been collaborating with the USAID, and I have another assignment to work with all USAID implementing partners. I think 5 or 6 partners. Those partners are implementing TB program, and I have been assigned to work with them on the digital health information systems. So, I mean, everyone was working on the COVID at the same time GB. So it's a great experience from my side, how to manage the infectious disease at a larger scale, but because of we didn't have that much experience how the program is being managed when there is a pandemic issue, something like this. And previously, I have seen like the surveillance program, like I work with WHO API surveillance program, and we managed to develop the surveillance system in Bangladesh with the support from CDC. And then after a few years of time, now it seems like we are. I'm back to surveillance program again, and then I see that this fellowship was instrumental to refresh my knowledge on surveillance system, and at the same time to collaborate with the government colleagues to mentoring them so that they can also learn from us and make the system sustainable when we are not here. So I think building the not only learning from them or at the same time we need to have something to offer so that they can learn from us. So it's like a peer learning process. And that's a great example for me that this peer learning, like from both sides. Yeah, over to you.
Thank you. Thank you so much, Mohammed. I did notice there are a lot of questions in the Q&A about sort of the application processes and the criteria and how fellows are placed in different locations. And I wanted to let you all know that we're going to sort of hold those questions till the second half after the break, because there will be program representatives who will be speaking a little bit about the programs themselves, and I think may address a lot of those questions. And then there will be a Q&A session after that as well. And then if we have any questions that haven't specifically been addressed, we'll come back to those. My colleague Mike Sage will be moderating the second half of this about the programs and processes themselves. They will address those kinds of questions later. So right now we're going to kind of focus on specifics related to the fellows themselves and their experiences. So I hope people find that useful. So one of the next sort of set of questions has to do with your personal experiences with the fellowship. And this is for all four of you, really. And it's a two-part question, which several people have touched on. One is, what compelled you individually to apply for the fellowship program that you are in? And the second part of the question is, what do you think were the sort of the key criteria or your key characteristics and traits that made you a compelling and strong candidate? So I'd like to hear really from all four of you on this. So maybe if you could each just take a very brief, maybe a minute or so, and just tell us why you were interested in applying for your program, and number two, what you think made you a good, strong candidate for the program and the reason that you were selected. Please don't be modest. I mean, this is the idea here is to help others who may be at earlier stages in their career think about how one of these fellowship programs or one of these programs might be a good fit for them. So we can start with whoever. Dr. Courtney, would you like to start? And then maybe we'll go to Dr. Cotter next and then come back to Mohammed and John. Is that all right, Courtney?
Sure, yes, that sounds great. I just want to make sure I've got the two parts. So what compelled me to apply and why I think I
was a strong candidate.
Okay. Right. As far as what compelled me to apply, it's cliche, but I've always wanted a true experience in CDC, but also I concentrated in global health in my master's and was hoping to enter that field. And I think I can relate to a lot of those that are online that they're applying or have considered applying to programs like this, that sometimes it's hard for that first entry point to get into global health if you haven't already been working globally. If you've been, you went to school near home, or you really only worked local in local health departments, that sort of environment in public health, to take that next step and to go globally is a bit difficult. So I think that's really what compelled me, was I saw kind of an open door to enter the global health field in a way that was a way to gain professional development, to open that door to CDC and to other partner organizations, and to really network through that program. So it's a great segue into global health, I think, and I'm really enjoying it. Obviously, I was it was a pleasure to speak today. As far as qualifying, that's a difficult one, because I think everyone arguably brings something unique to the table. I think as individuals, we can bring something that a team doesn't already have, some type of expertise or some type of background or experience that, especially in smaller teams in CDC, they don't already have. I'm going to give a specific example. For my case, no one spoke Spanish on my team already, as well as there was a lack of kind of informatics skills. My team is very well-rounded, very diverse. However, they just haven't gotten more into the IT world, unfortunately, and that's kind of where global health is headed, is all these digital innovations. You have to have some sort of IT and informatics background. And so kind of honing in on whatever you find your expertise to be, whatever is your strong suit. If it is IT, or if it's engineering, or it's something that's a bit outside of public health, don't be intimidated to apply to a program like this, because odds are they're actually looking for someone exactly like you. I think people get too intimidated by global health or by public health if they're entering from a different field or career field, or something that's parallel but not quite public health. And I don't think that they should be intimidated, because a big part of CDC is that we need to be diverse in both cultural and language backgrounds, as well as career backgrounds. We need more engineers, we need more IT, we need more diverse expertise. So I think my biggest piece of advice when wondering, do I qualify for something like this, is be confident in what you know and be confident in what you're bringing to the table, because odds are for your specific team or where you're applying, they do need you. Whatever language it is you speak, whatever expertise it is that you think maybe isn't relevant to public health, I promise you it is, because public health, it comes from all angles. So I guess that's my main takeaway. Thank you.
Great, thank you. Thank you very much, Courtney. I think that's good advice for people thinking about a career in global health. Dr. Cotter, do you have some a few thoughts you'd like to share about how you came to be with the STAR program, and what personal qualities and characteristics and traits you thought made you a strong candidate?
Well, thank you. Very interesting. So I have been working in the field of tuberculosis since 2008. And that all over the USAID funded project that was TB Cap, TB Care 1, and also Challenge TB project. So in addition to that, when I saw the announcement, and I found that there are some additional skills that I need to develop, and I found that the STAR project is the good opportunity, so I could further develop that skills, particularly that is the leadership and skills that I needed to develop, and therefore I applied for this position. And why it made me so strong, that is because I had the good experience in the field of tuberculosis. I have worked for 10 years or more in this field, and I thought that I could be the good candidates who could provide the maximum advice to Ministry of Health and also National TB Program of Afghanistan, so as to find the TB cases, treat them, and at the end award the deaths. So I was one of the candidates that meet the criteria, and luckily passed the interview and hired by the STAR So I'm very happy working with the START because that was new experience, and I have learned a lot of new things, including this, how to manage this or work in a circumstance like the pandemic. And during this period, the START has provided us the opportunity to develop the skills using the virtual system. Thank you.
Thank you so much. That's excellent input on leadership, on the importance of leadership and those leadership skills. Mohammed, could we ask you the same question as well? How you came to be with the STAR program and your skill set that you thought made you a good candidate?
Thank you, Big. That's a great question, actually, for the new public health people. Actually, I was working at the health ministry level with the Measure Evolution program. At that time, I was leading some of the health informatics for the Ministry of Health and Family Welfare, and also the monitoring evaluation. So I got the opportunity to apply. So I realized that I need to go for a deep dive into TB program, tuberculosis program. I mean, I previously worked on the TB program, but on the digital health informatics side, not the like programmatic side. So when I got the opportunity, and interview was taken by USAID and the government both, and they hired me. I was happy because of now I'm learning the nitty-gritty of the tuberculosis program based in the anti-office. And at the same time, I believe my strong skill set is like strategic planning and also the leadership. And so those are the skills actually help me actually to have a strong ground in the TB field. And also working with the like diverse partners in tuberculosis program in Bangladesh. So I'm now coordinating not only the USAID implementing partner, but also like with the other partners like Global Fund, WHO, and BRAC, some other organization. I mean, whenever we design or develop something, even a presentation, like today we have made a presentation to the Global Fund. The presentation we developed, that was developed in a concerted effort. So everyone provided inputs, and then the presentation finalized, and then it was presented by the line director of tuberculosis program. So this, first time the collaboration also a great skill. So although I was preparing the presentation, but I was coordinating with everyone to make sure everybody is heard and everybody inputs is gathered, so that everybody feels that this is the country presentation. So that is another beauty of the program, of tuberculosis program, multi-sectoral approach. Yeah, over to you.
Thank you. Thank you, Mohammed. And finally, John, do you have any additional thoughts you'd like to share from your perspective?
Sure. Thank you for that. So just quickly, what originally had compelled me to apply was the mentorship component that this fellowship has. And so, after graduating with my master's in public health, which was also like Courtney's focus in global health, I knew I wanted to work in global health in some capacity, but I didn't know what that would look like after graduating with a master's. And so I felt that I needed more guidance, and that's what this fellowship kind of provided for me, in terms of connecting me to a wider support system that perhaps wouldn't necessarily be there if I were to just step into a full-time position at another organization. And so I being someone that thrives with that interpersonal mentee-mentor relationship, I knew that if I were able to have the opportunity, I would be able to succeed and network to build on those connections and relationships, because I do value those and have seen the benefits that it has brought me in my career. Secondly, with regards to the key criteria, I think that we all, for those that are interested in applying, I would just say go for it, because there's so many there's so many factors that are beyond your control that you'll never, I don't even know how I was selected, and so you'll never really truly understand all the factors that went behind, that contributed and impacted your application process. I feel that if one just goes for it and puts their best foot forward, does their research, talks to people who have, perhaps like us, that have had these experiences, and really focuses on building a strong application that really talks about not only your experiences and what you learned from it, but also personalizes those experiences. And so I think that sometimes people shy away from combining the professional with the personal, but I think that if we are putting our best foot forward into an application where we're not necessarily able to make our case in person, that personable aspect to your writing is something that you can leverage and that could really help make you stand out apart from your competitors. And so I would suggest or just encourage those to personalize your stories, personalize what got you into public health, and really reflect on how that looked like in terms of your experiences. How have you persevered? What challenges have you faced, and how have you overcome them through the career of public health? And just lastly, I would say that a lot of it sometimes as well is luck. Who knows what they need during that cycle of the application? Don't give up just because perhaps the first cycle did not work out. Just a quick story. I was not even going to be interviewed. My mentor, during our first dinner, she said to me, "John, you weren't even part of the interview pool." And so my team did not select you until I got to the office after vacation. I looked again through the applicants and I decided that I wanted to interview you based on X, Y, and Z. And so just even that demonstrated to me that there are so many factors that we'll never really know about, that there are people that might want you to be on their team versus others that might see other applicants as having a better skill set. It's relative, but I think that in terms of you going for it and seeing yourself as valuable, seeing your skill set as valuable, and that it could potentially be appreciated within a team is what matters regardless of the outcome. Over.
Thank you, John. And I really think that all four of you have answered this question in very personal and in a very effective way. The themes that I heard pretty much from all four of you were around leadership, a willingness to learn, and work in teams and with mentors, and be willing to being humble and being able to assimilate new information, to be organized, and to be a good implementer and operationalize these sort of complex activities. And the key thing I think we heard from all four of you is the importance of going ahead and bringing it to the table. If you're passionate and you're committed and you're compassionate about public health and about doing good public health work, everybody brings some unique things to the table, which might be very, very valuable depending on which programs you end up working in. So I could not agree with you more. At my stage in my career, looking back, I've had very similar experiences getting into public. I wasn't always in public health. I mean, that started maybe 25 or 30 years ago, well into my career, and I completely agree with you. Okay, the next question, or the next sort of category of questions, has to actually do with COVID. And people are very interested in some advantages, challenges, how you integrated and how you pivoted from your previous work to the COVID response. How did all those existing programs pivot, and how are they impacted? Do you have how did that integration happen in your country, for example, in Bangladesh and Afghanistan? I think, Dr. Khader, you covered a little bit of this in your earlier remarks, but if you have anything you'd like to add And then there's actually a specific question about Bangladesh, which might be relevant to the rest of you as well, about how, and this is a question that came from Nigeria, from someone in Nigeria, with a country with very similar population. What was done to sort of very rapidly, it appears, bring down your incident cases and taking into consideration the population and the socioeconomic situation in a diverse country like Bangladesh with a large population? How did you manage that? So it's a bit of a two-part question, and you don't have to answer both parts if they're not relevant for you. But can you talk a little bit about the advantages, challenges, existing programs, pivoting to COVID, and how that has impacted your work in the last year or so? So let me start with Courtney again, if that's okay. And Courtney, if you'd like me to come back to you later, but if you'd like to start, and then we can move around the screen again. So thank you.
No worries. I'm just kind of gathering my thoughts. Okay, so let me try and tackle both points. Honestly, I'm going to first start off with, it's going to look different for everyone. How that, obviously, the four of us answer this because we have very different contexts. So I'm going to speak on behalf of the headquarters of CDC and what it looked like from Atlanta, which kind of describing that environment is a bit different because it's tailored to many different programs, many partner organizations. There's a lot of moving parts all at once, whereas sometimes with other country offices and other partner organizations that are, for example, in John's case in Guatemala, like you will have kind of more of a country-specific aspect sometimes. It really depends. So keeping that in mind, I would say for me, the shift happened really quickly because I'm on the vaccine safety team. So as soon as the pandemic hit, it shifted a lot of what we were focusing on because we knew in a very short time, these vaccines were going to be ready and we were going to have to be prepared with all of these documents, guidelines, surveillance manuals, those sorts of things that we put out for the global community around vaccine safety specific to COVID vaccines. So I have to say that, my experience is going to be very different from the rest of yours, but the shift in my priorities was the first thing I noticed. A lot of, retrospective data analysis and things like that I was working on really got put on the back burner because we realized, we already have this data. It is important, but it's not important right now. And so my day-to-day and my projects I was working on shifted tremendously to preparation, to kind of a totally different phase of work. Let's start from scratch. Let's look at this problem and let's anticipate how these vaccines will look, the phases of the vaccine trials, where they would be implemented, how COVAX was going to be assisting our countries that we specifically support, and those sorts of things. So it became strategizing, planning, preparation, and kind of starting from scratch because, of course, we didn't know very much back then. And then kind of taking off. Because it was in a planning stage, I have to say that as a fellow, it was a bit intimidating because you're not as set in your role on the team. You are the newest member, perhaps the youngest in that career field specifically. Like I had not had any vaccine safety experience before this team. And so that was where it became a great opportunity for me to temporarily deploy to the COVID response in the Emergency Operations Center in the UOC, because I knew that they were already organizing kind of sub-projects and sub activities that I could directly and immediately support on. So I would say kind of a piece of advice is step back for a second because it can be overwhelming and recognize what you can control and what you can do as a fellow. Recognizing that it's okay to be new, it's okay to not know, to not have that level of expertise that your team members are going to have, especially in the context of COVID, because we were having, all sorts of international partners asking us for advice and things that I couldn't answer to. So I would say recognize your control in the situation. And that's when I deployed to COVID. And then it gave me a sense of what was actually going on in the world. It gave me a sense of COVID specifically. What is this new virus we're seeing? Let's just take a moment to actually learn about the problem. And then moving forward, by the time I had finished my deployment, I was so much more comfortable with COVID and with the topic area, with the potential vaccine safety implications that were coming out of it, that I was able to more directly support my team in a way that I felt comfortable with. And by that time also, I think that my team had organized their thoughts, their projects that we would be working on together, that when I was re-implemented in the team, it was in a more clean cut or straightforward direction. So I hope that I kind of answered that. It's a very complex question, a complex idea, because each office, each team is going to look very different, but yeah, thank you.
Thank you very much, Courtney. Yes, you did. I thought you did a great job answering that question. And I have just been told that we are actually very quickly approaching our break time. So we're not going to have time to go through and have each of you respond, but we do have this burning question about Bangladesh. So Mohammed, if it's okay with you, I'll come to you. And could you very briefly just talk about your pivot to COVID activities very briefly, and then touch on how Bangladesh has managed to have what appears to be a pretty significant impact in terms of decreasing cases over the last few months, and anything else you want to touch on related to the pandemic experience over the last year or so. So thank you.
Thank you, Vic. Actually, the COVID pivot work, actually, I have been working from home a few months. That's the teleworking, which we are not habituated at. And at the same time, the credibility of our work, because of we are delivering our deliverables via email. So government is also aware that we are working for them. So that's the cultural shift is there. The government accepted that. You know, the subcontinent mindset. So as they are working from office, I mean, you can't stay at home and work for them. That's not accepted concept. So that is one of the critical part of our work, but we have overcome that. And regarding the COVID infection in Bangladesh, Bangladesh actually, the first COVID case was identified in March last year. And then there was a, just quick upward, like logistic curve. And then eventually Bangladesh got at the very beginning, prepared the country preparedness plan at the very beginning. And they went for closing out the borders and routine investigation. Also look at all the time, they have like every day, Bangladesh government actually organized a press briefing to inform the media what is happening and what are they doing. So regarding the case positivity rate, regarding the case fatality rate, and they were looking very strictly to the evolvement of the disease. And at the same time, the government office, as I said earlier, was open. Everybody's on the field, even though at the beginning there was some logistical issues there because of personal PPE, protective equipment, are not available that much. That was such suboptimal level. Masks, there is a shortage of masks, but Bangladesh actually, the Bangladesh is a big market of manufacturing, garments manufacturing. So the government actually negotiated with them to produce masks, and at the same time, the sanitizer, hand sanitizer, and so I mean, they actually focus on what they have, and at the same time, they actually put enough emphasis on the surveillance system. Bangladesh has the experience of immunization surveillance program. That was one of the successful program. So they actually collaborate with the partners and the governments to actually replicate that surveillance system in this program too. And probably, and if you think the vaccination program, Bangladesh was one of the few countries who actually immediately rolled out for the vaccination program. Like for me, I got the shot. So many people, actually, those who have over 40 age, they have got the shot. And probably many people say probably the Bangladesh didn't face, embrace the variants, that much many variants, actually, the stronger variant of the virus in the country. So that could be one of the reasons. Not our, some people say that that could be a genetic factor because of our lifestyle. We are more actually resistant to that, that virus, to be affected by that virus. So I'm not sure. Those are like a research question, but with the leadership of the Prime Minister of Bangladesh, and also the development partners, we have been able to actually curb the infection. Now the growth rate is like, if you take a 7-day rolling average growth rate, say it is like less than 1. So it indicates that we have somehow controlled the infection. Yeah, I mean, that's I can say just very briefly. Thank you. Over to you.
Thank you very much. And I know that it's now time for our break. I do want to thank everybody who has joined us. We have about 300 people, I understand, online, which is really amazing for a virtual event like this. I want to very much thank Dr. Kader, Courtney, John, and Mohammed, who have been wonderful panelists. You guys all have brought very unique experiences, and you've been very articulate and willing and able to share your experiences, not only about the program itself and your experience with the program, but also more broadly about the work that you've been doing and how the COVID pandemic has impacted your work, both professionally and personally. I would like to implore all of you that are online, we're going to take a short break at this point. Please come back. The second session of this event is going to be really, really good, particularly if you're at all interested in either of these programs, or if you'd like to hear more about how the programs are structured, how the application process works, the criteria for selection, and so on. I think those are the kinds of things that Mike is going to moderate in the second half with experts from the programs and representatives from the programs who are going to talk about those kinds of things. So I hope all of you will stay on and join us for the second half. Jasdeep, what time would you like everybody to come back? I have 10:55 Eastern Time, 9:55 Central Time. So would you like everybody back in 10 minutes? Is that okay?
Jasdeep is reconnecting to audio, but at the top of the hour is okay. The
top of the hour? Okay, so everyone, we will start back in exactly 5 minutes, which would be 11 a.m. Eastern Time or 10 a.m. if you're on Central Time. And if you're on other times like Bangladesh time, sorry, Mohammed, you'll have to do your own calculating. But thank you so much for joining us. And I'd like to offer a virtual hand for all of our wonderful panelists. So thank you so much. And thanks to all of you attendees as well who slogged through the technical issues with us. But I think we've got that resolved now as well. So thank you. Please be back in 5 minutes. Thanks.
Well, it's a little after the top of the hour, so let's get started. The program today was set up into 2 parts, as Vic said earlier, the first part being experiences of the fellows. In this hour, we will focus on, both the program aspects and opportunities, both for the CDC PHI Global Health Fellowship and the STAR program. And I'm going to just let Natasha, Abdul, and Jennifer introduce themselves instead of introducing them to give us more time to really focus on the projects themselves. So with that, let me just turn it right over to Natasha to start, and then we'll go to Abdul and to Jennifer, and Then we will have a Q&A session at the end of it. So Natasha, you want to start?
Perfect. Yes. Hopefully everyone can hear me well. Thank you and welcome to the PHI CDC Global Health Fellowship Program informational session. And you've made it through to this section. I know there was like a lot of questions that were coming in regarding to how can we apply, and I will get to all of that within this session and the Q&A following. So today's session is about 20 minutes, following immediately with another informational session. Both parties will then return at the end to answer all of your questions. So we do see them coming in, and please be patient for us to then answer it. And like I said, many of those will be answered in the session as well. Next slide, please. Thank you. So quick introduction. My name is Natasha Alcaz. I'm the Recruitment Fellowship Support Coordinator here with the PHI CDC Global Health Fellowship Program. I've been with it for a couple of years now and have had many pre-COVID onboarding and recruitment experience and COVID, recruitment and onboarding experience. I saw some questions that came in regarding that as well and how that may have impacted it. So it was successful both times, right? And it was very unique, pivots and updates within it, but I've had a lot of experience with it. And then I will allow my co-presenter to introduce himself. You're muted. Abdul Ali, you're muted.
Sorry. Hello, everyone. My name is Abdullahi Farah. I am the University Liaison Program Officer. I recently joined this program, and I will let Natasha lead us the way.
Yeah, thank you. Well, you're doing the next couple slides, so thank you. Right. Next slide, Jasdeep.
Thank you. So the PHI CDC Global Health Fellowship is a CDC-funded program that offers recent graduates from CUGH, or the Council on Education for Public Health accredited institutions, the opportunity to participate in a year-long fellowship with leading global health experts from the CDC. So the prime implementer of this program is the Public Health Institute, and the Public Health Institute has formed a partnership with a consortium of universities for global health, abbreviated as CUGH, to support the program in 3 different areas, and that is outreach, recruitment, and also professional development once the fellows are on board. So this is a cooperative agreement under the CDC Center for Global Health. And our recruitment strategy is to develop first a pool of applicants and then match each applicant's interest and experience with that of the fellowship program. Each year we recruit at least in between 25 to 30 new fellows. And we continue to support an average of 50 fellows each year in the program. Currently, we have about 70 fellows who are actively partaking in the program. Next slide, please. Thank you. So the core objective here is to support CDC's global health mission, while also providing our fellows the tools necessary, both professional and technical tools necessary in order to excel well in the global health workforce. This program is being built on a history of fellowship programs by the CDC and the Public Health Institute for graduate level public health professionals in order to build a strong and competent global health workforce. This particular fellowship places emphasis on 6 areas that we call tracks in the program, and that's epidemiology, HIV prevention, program management, monitoring and evaluation, strategic information, and surveillance. Next slide, please. So many of you may be already familiar with the CUGH. For those of you who are not, the CUGH has a wide network of contacts in academia, including CEPH accredited institutions. The CUGH has been a key ally for the PHI CDC Global Health Fellowship in the three areas that I have discussed earlier, which is outreach, recruitment, and professional development. The CUGH has been instrumental in developing connections between the fellowship and accredited institutions nationwide. We have been also very critical in spreading awareness through outreach in both virtual and in person. CUGH also has been very helpful in the area of the professional development for the fellows once they are accepted into the fellowship. Fellows benefit from CUGH's training resources, including webinars and conferences, some of which are free and or at a reasonable cost. So during the fellowship, fellows also have access to the liaison program officer, who would be myself this time, who can also recommend additional training opportunities and also give them access to a member-only page by the CUGH that has additional training resources, various topic discussions, and also employment opportunities. I just want to conclude in this section by addressing the issue of the Global Health Workforce Panel, who are critical in supporting the application review and the recruitment of the fellows. These are experts in one of the 6 areas that I have discussed earlier, who volunteer in this program, and they see the fellows as future global health leaders, and they're quite excited to be taking part in this process. Thank you, and I return back to Natasha.
Thank you. Next slide, please. Perfect. So just some additional information regarding the fellowship placements. I saw some questions come in about that. So yes, they are full-time. They are one-year placements within CDC offices worldwide, where leading experts within CDC and CGH serve as fellows mentors and provide day-to-day guidance. Again, fellows are placed within one of the 6 different technical tracks, as you heard and relisted here. You can see the overall track placements from this past program year in the graphic below. This does fluctuate a bit each year, but as you can see here, majority of our fellows are placed within surveillance and epidemiology tracks. Again, this is based off the needs of global health, and so this can vary year by year. Fellows are, hired on as PHI contractors and receive a monthly stipend based on the Atlanta's GS pay scale. So GS8 Step 1 for an MPH or MSPH degree, and GS9 Step 1 for PhD in public health. They also receive allowances, so health, housing, travel, etc., that helps offset their needs and access training, professional development, and advice and resources. So all of this throughout their fellowship year. Next slide, please. So currently we have about 64 fellows in 16 different countries, as you can see here in the graphic below. These placements, again, change and vary year by year due to the needs of global health, but you can definitely see majority of our domestic fellows are placed in Atlanta, right? And then a majority of our overseas fellows are within South Africa. And yes, next slide, please. So restating a little bit of what you saw in the previous slide, this is a one-year fellowship program with the ability to renew for up to 3 years. So a lot of candidates are really excited about that. And especially as you heard from our previous earlier in our earlier sessions today, many of those fellows have, or were in their 3rd or 2nd year, and within one of the 6 different technical tracks. The program strives to recruit fellows that exhibit unique skills to support CDC's leading global health experts. We often get asked, if you have to already be fully experienced to be able to apply and be in the field, and that's definitely not the case. This is a training fellowship. And, I think it's important to note that most of our, accepted finalists are recent graduates. So they're literally completing their MPH or PhD program before they start in that September with the program. And it's, like I said, a training fellowship. So to apply, and we'll talk about eligibility in an upcoming slide, it's for recent graduates who've also completed the degree within 5 years. Next slide, please. So I'm not going to go into this whole slide because you just, heard from him earlier today, but I did like to take a couple slides to quickly highlight, a few of our fellows. So re-highlighting one of our fellows here, John Yaramillo, who you heard from earlier today, who was based in Guatemala. And as of January this past year, is now an alumni of the program. And he continues to work with CDC and is located in Atlanta now. So you can read more on his work on our program's website and, listening to the session from earlier today. And then additionally of all our other fellows, such as, next slide, another fellow here, IIE, who is currently an active domestic fellow based in Atlanta, Georgia, and focuses on HIV-related projects. So all of our fellows work on differing projects, all pertaining to global health. And the program aims to find opportunities to highlight the fellows' work. So really exploring, I wish I can go into all of the fellows' work during this presentation, but that wouldn't do them service. So we definitely do take the time to highlight them, and you can find it all on our program's website. Next slide, please. So eligibility, we're seeing a few questions regarding that. The program does have very specific eligibility requirements. So applicants must have an MPH, an MSPH, or a PhD in public health from a CEPH accredited school or program. And this is for recent graduates, so must be obtained within the past 5 years of when they would be starting this fellowship year. And the fellowship year does start always September of the program year, and then it ends August the following year. So it's follows, I like to say, that academic cycle. Due to specific clearances required by CDC for this particular fellowship, applicants must also be a US citizen or a US permanent resident. And then finally, again, this is a full-time fellowship year. So applicants should be aware of the commitment, again, from September to August the following year. And additionally, ideal candidates should exhibit skills in the various technical tracks of which they are applying for, and more within global health. Next slide, please. So I truly love highlighting our website, as there is a lot of great information within it that is continuously being updated. Upon going to our website, so I'm sharing a screenshot of what you would see here. If you go to our website, phi-cdcfellows.org, it is important to note that the login button that you see in the top right corner is strictly for our current and active fellows. So once they become, once you potentially become an active fellow, you will have access to a lot of great resources that the program offers, in addition to your mentorship guidance and your day-to-day work. And then through that, though, there's also the ability to learn more about how to apply and when that application portal becomes available. So that is available mid-December. So it just passed, right? So all applicants for this upcoming 2021 to 2022 fellowship year actually submitted their applications this past December and January, and I will review that timeline soon. But you can learn more from here and how to connect. And the next slide, please. I'm going to go to a specific page within it. Specifically within the Connect section, there's news, there's blogs, and there's also our Global Health podcast, which has become, exceptionally popular. I would say if you like listening to podcasts, this is a great opportunity to hear more from CDC mentors, program staff, our current and past fellows. It's a great way to gain more of an insight into their specific work and really hear and explore the many branches of global health. As I'm sure you can imagine, I think I'm constantly amazed by this, of how wide, this goes. So definitely a great opportunity to check out the podcast page if you can. Next slide. Thank you. So the recruitment timeline, there's definitely a more detailed one on our website, but I want to not overwhelm you for the sake of this informational session and just kind of provide a little bit of a general overview. So It does take quite some time from the moment that the applicant applies to when they may receive their notice of a fellowship. So applicants apply and the application portal becomes available once a year, and it typically opens mid-December, and applicants submit their applications from then until mid-January. And from there, all eligible applicants are then reviewed with the Global Health Workforce Panel, and they are equitably and fairly reviewed by multiple reviewers and scored. And those that are deemed, qualified and have the skill sets that we are seeking are then advanced for CDC mentors to review. Select candidates are then interviewed, and then select candidates are then offered, a finalist and a verbal offer fellowship placement, right? So from the time that a candidate may apply in mid-December to when they may hear a potential offer for a fellowship placement in early May, it does take quite some time, which is why we go through this cycle once a year, right? Typically. So in case you're wondering why there aren't mid placements typically, or, why this isn't like an ongoing throughout the fellowship year, it does take quite some time to go through it all. So that being said, if you would just miss this past cycle, but you're interested in future ones, stay connected with the program to kind of hear more about that. Oh, wait, still previous slide. I'm not done with that yet. Sorry, thank you. But, once you go through the whole review and you get that acceptance in early May, then begins your onboarding. So from May until the start of September of when you start that fellowship program, you actually are going through pre-work with the fellowship of completing on your onboarding requirements. And this is especially critical for those who have placements that are overseas, right? Like visa requirements, you're packing up all your items. There were questions about what happened pre-COVID and during COVID. So definitely in pre-COVID world, right, fellows got their placement, and then all fellows attend a 2-week orientation with the program. That's typically at headquarters in Atlanta. And from there, then our overseas fellows, go directly to their overseas placements, right? So all of this pre-work has to be done during the summer. During this past year, we still managed to go through recruitment. We still were able to provide all those fellowship offers, and we were able to transition to have all fellows start virtually and remotely. I'm not going to go into all the details with it, but we were successful to still have all fellows start the fellowship year in September. They still attended orientation, though it was virtually, and then they immediately began working remotely with their host offices. We hope in future years, right, that, as things open up, that it will go back to what it was before, but it's too early to give that definitive answer, right? We have to kind of see how things progress forward. And I will say a lot of our overseas fellows are now relocated to their overseas placements, and we're about halfway through that fellowship year. So I will now go to the final slide. Thank you. So that being said, right, please stay connected with us. I think it's important to be notified when the next application cycle opens and to hear more tips. We usually offer multiple informational sessions during the program year. There's opportunities for you to sign up, whether you're eligible or not for the program, to sign up and receive one-on-one guidance and resume tips. We also provide a fellowship experience as we get closer to the next launch of the next application cycle to provide, helpful tips and any updates that we may have. So please stay connected. And then as well, we have the Q&A session later, but if you have to hop off, you can always email us questions at info@phi-cdcfellows.org. And yes, thank you. I made us come back to the appropriate time. Hopefully I didn't go too over. So now we can transition into the next session.
Hello, everyone. Thank you so much for joining us today, and I'm happy to share some information about the STAR program. My name is Jennifer Dogby, and I serve as the Director for Recruitment and Outreach at STAR. Next slide, please. Okay, so STAR is a 5-year project, mostly USAID funded, which was launched in May of 2018. And what we do is we are a global health capacity building fellowship program that recruits and places fellows and interns around the world. STAR fellows in particular get to provide technical support needed to build capacity at the organizations at which they serve or are placed. Fellows are our fellowship programs, or actually all our positions are salaried. So both our interns and our fellows are paid positions, just like any other job that you would get. The difference is that they are time limited, just like the CDC program that you heard. So the fellows serve for 2 years, can be retained for an additional 2, but they do max out at 4 at the most. Our internship length of time ranges from 3 months to a year at the most. So who can be a fellow? With the STAR program, local nationals within their country, third country nationals, meaning someone from one country going to work in a different country, or US citizens. Each positions that we advertise online will actually specify the citizenship requirement for the position. And then where can they work? Majority of our fellows right now work at the Ministries of Health, mainly at the National TB Program, like you heard from our fellows earlier this morning. But also USAID Washington office in Washington, DC, and at missions around the world. We can also make placements at local NGOs, academic institutions, etc. Next slide, please. So what are some of the technical areas where our positions, what we would recruit for with our positions? So this is just a list, just like the CDC program that you just heard. Lots of different technical areas, whether it's TB, HIV, malaria, maternal and child health, supply chain, communications, behavior, social and behavior change, nutrition, etc. So it's a wide variety within the global health arena. Next slide, please. Just to give you an example, obviously you heard from some of our fellows overseas this earlier in the session, but this is just a few examples of some of the work and backgrounds that some of our fellows have. This is Hawa, who's our TB fellow in Uganda. She works at the Ministry of Health. And as you can, I'll just give you a few minutes to just go over what she does. But just as an overview, our fellows on a day-to-day contribute to the work of their host organizations through capacity building activities, such as strategic planning, program scale-up and design, strategic partnership management, and transferring specialized technical skills and knowledge. Staff fellows or participants are also expected to focus up to 10% of their time dedicated towards learning activities that address their individual and professional development goals. Next slide, please. And this is just an example of one of our interns over here who's with the pediatric and adolescent HIV treatment team. And just a little bit of her background. They obviously with the interns, they support because they're not coming in as technical experts, but they do support a lot of the work that we've mentioned that the fellows do as well. Okay, next slide. So this is just a map of the countries in which our fellows serve. We currently have 92 fellows in about 31 different countries. And majority are overseas. And then we have about 13 interns right now. Majority are in the US at the Washington office in DC. But just to give you an idea of some of the areas, as you can see, it's mostly Africa, Asia, and of course, in the United States. Next slide, please. So what are some of our requirements? For the fellowship program, we have three main programs, three main sorry, give me 1 minute. We have three main levels. So we have the technical advisor level, which is our entry level fellowship area. These are the requirements, at least a bachelor's in 4 years or a master's in 2 years. And then we have our mid-careers technical level, and that's bachelor's 9 years or master's 7 years of experience. And then of course a senior level, which is at a much higher requirements in terms of the years of experience and education level required. Okay, so each position that is advertised will actually outline the required skills, the experience needed. And then for the applicant, the main thing is to pay attention to what's required and also what is preferred or a plus. But we obviously will pay attention to what's required when reviewing applications. Next slide, please. For the STAR internships, the requirements are obviously slightly different. At the internship level, we will look at students who are currently enrolled, maybe at the senior level at least, or senior year, or have completed their program within the last, for the bachelor level, it's 24 months. For the master's and doctoral level, it's 12 months. The citizenship will be based upon where the position is placed. So for the US positions, the citizenship will be US or US citizen or US permanent resident. The degree type will vary depending on the job description of what they're looking for. And then additional requirements will also be indicated within the job description. Next slide, please. In terms of our application process, as you can see, it's pretty, we hope, straightforward and easy. It's really, someone creates a profile online, uploads a resume or CV, as well as a cover letter that is tailored to the position that they apply. They create a profile, but also have to actually apply to a position. All of our positions are on demand, meaning we don't have a one cycle. I think like you heard with the CDC program, our positions are throughout the year. So both for our internships and our fellowships, we do have some summer-specific positions for the internships, but again, we still do have positions throughout the year. So I would encourage everyone to sign up with our listserv on our website so that you can get notifications as soon as a position opens, as that's the best way to learn when a position opens. In terms of selections, we review applications again based on the requirements of the position. Qualified applicants are then shared with our hiring teams. They then select who they'd like to interview. Once they make a decision as who they'd like to move forward with, we check references. And then if everything checks out, then we make an offer. The onboarding process does require, depending on where the placement is, if it's at a USAID location or facility, then it would probably require security clearance. If not, it would not, and we would just move forward with getting the person onboarded or started, and they report to work on an agreed upon start date. Next slide, please. So this is an approach that we use with at the STAR project. We all have biases, which are conscious or unconscious. Sometimes the unconscious biases will drive the decisions we make without really knowing we're basing our decisions on them. So when hiring, people tend to hire people who look like them, think like them, and maybe have gone through the same schools or have gone through specific desirable schools like Ivy League schools in the US. But then it leaves everyone else out who might be even more qualified or better suited for a position. So at STAR, we use a blind recruitment approach for our US population in order to create an equal playing field and ensure that the opportunities are accessible to all. So what is blind recruitment? It's the process of removing personal identifiers. So we want to remove any possibility of one's ethnicity, gender, location or geography, disability, and even names of schools they've attended. So we have the hiring teams look at applications that don't have any of this information, personal identifiers. Only after they've selected, made selections as to who they'd like to interview, do they finally see the original CV or resume and cover letter. And we've seen with the time that we've done this, a lot better results with who's then selected to move forward with positions, or at least having a chance to interview for a position. Next slide, please. So here are the current positions. And again, I encourage everyone to sign up with our listserv if you haven't already done so. This is just to give you an idea of the type of roles that we have currently on our website. These are in different countries for the fellowships. The first one is in Cambodia, the second is in Ethiopia, and the third is in Indonesia, just to give you an example of some of the countries that we make placements. For the internship positions, those are mainly in Washington, D.C. Okay, next slide, please. Thank you again for joining us for this session. This is just the website, information about the listserv, the website. Join us on LinkedIn and Twitter if you haven't done so. And thank you again for giving me this opportunity to speak to you about the program. And thank you.
Thank you both. Oh, actually, all three of you for great presentations. I'd like to just move right into the question and answer period, seeing that we have about 25 minutes left in the program. But there is a question that I think before I turn it over, questions over to the panelists, there is a question that came in from Kim on how does the Global Health Program differ from the EIS program, which is another CDC program. And I think I probably in the best position to answer that question. EIS is historically the oldest fellowship program at CDC. It's historically been focused for epidemiologists, and it is one track, epidemiology and epidemiological sciences, and focused more in the clinical nature of public health and epidemiology. It, for years, probably for its first 30 years, was only open to MDs. But in the recent past, in the last 15, 20 years, it is open to also PhDs. It is different from the Global Health Fellows program in that the Global Health Fellows program is focused on entry level at the master's in public health level, has the 6 tracks to pursue. So it's a wider variety of tracks to pursue a post-graduate training. And it really is very much focused on entry-level graduates into public and global health. And so they're very, very, very different programs. And with EIS really being where you would focus if you were an MD or you were really at the PhD level and interested in the epidemiological sciences and the clinical side of epidemiology. With that, I think we'll just go right into questions for Natasha, Abdul, and Jennifer. I'll start with the first one that came. It's what has been the most helpful advice you would be able to give to current applicants during the pandemic and thinking about either of these programs to apply for? Why don't we start with Jennifer?
Sure. I think it's not that much different from what we would have said earlier. The most that we saw in terms of delays that the pandemic had was, I think initially we had just delays with how long it would take, because the USAID was obviously heavily involved in COVID response, and that took priority. But I think everything is kind of back to normal now. The difference just being everything is virtual. So it's continuing to put your best foot forward in your application, just doing a thorough job with either tailoring your CV, resume to the position, ensuring that you understand what the job requirements are, and just ensuring that you complete your application, and yeah, putting your information, your best foot forward with what you put in your application. Thank you.
I'll add on. Since our cycles, the applications open once a year, there weren't too many differences like pre and during pandemic, because again, it was all virtual, right? You had to submit your application online, and really it comes down to like time management and making sure that you can, complete all the written responses. So the application has you put in some information, verifies that, you are graduating or have plans to graduate from a CEPH accredited institution with the eligible degree. And then there's various fields within the application and written responses about the tracks that you are interested in applying to. During this past year, I think there was a little bit more flexibility for the recruitment process. So there was a few late recruits, but you still had to have submitted your application during that initial window to be considered. So even if suddenly there were more placements available, it's still from those who originally submitted their applications, of which we would connect with and see if they are still interested in. So yes, I think that answered that question. I think I saw another question on if you're able to apply. So if you are working on completing your degree, so long as your degree will be completed before the start of the fellowships, I think we say before the end of June. So the fellowship begins in September. So long as your degree will be completed by the end of June, prior to that, you can submit your application.
Yeah, Jennifer, that's probably a question to you also. And with STAR, it might be different. Can you, while you're going through a program and getting your education, can you apply for a STAR position?
Yes, that would be, however, just for our internships, not our fellowships. For the fellowships, you do have to have a completed degree. But for our interns, we do hire internships who are either in their senior year or have completed within the last, for the bachelor level, 24 months or 12 months for the master's and PhD level. So it's, yes, you don't have to have completed, but that's for the internships. And they are paid. I think I saw another question just come in that they are paid.
The internships are paid internships.
And yes, paid internships and fellowships, yes.
So another question is, as you're thinking about this year and thinking about if you were in school or seeking a STAR position, thoughts on actually best completing the application. What advice can you give on the application process and successful, what you've seen as successful applicants in the past?
One is, don't wait. The process does take a long time. So I would say, even if you're about to finish your program, but you have a few months left, I would say start as soon as possible, because probably by the time you complete is when the process might even just get started. Sometimes it does take a long time, again, depending on how busy the teams are. And again, just reading the requirements of the positions very carefully. They'll outline exactly what they're looking for each position. And then that's where you take your time to tailor your responses, your CV, your cover letter, so that you can look, if it's just a general message that you're sending, a general cover letter, imagine that 100 other people also putting in the application, and that's not going to stand out if someone else took the time to tailor their responses or to tailor their message in how they display their skills and experience for the hiring team. So you have to put the time and effort for you to really stand out where we're looking at so many applications. Thank you.
Yes,
Natasha,
I agree.
your thoughts?
Yeah, I agree. Everything Jennifer said applies for our fellowship program as well, like spot on. I will add, because this is a training fellowship, and I mentioned this a little bit during the presentation, a lot of, we offer informational sessions throughout the fellowship year. So if you stay connected with us and our mailing list, you'll be notified. So those were the one-on-one sessions I was referring to, where the program offers resume feedback, because we wish we can offer it to everybody all the time, but we're swamped. But we do try to make opportunities to provide that one-on-one guidance. And what I've noticed during those sessions is, candidates are always asking like, oh, I'm really excited. I feel like I don't have enough experience. And then as we start looking over their resume and I start asking probing questions, you start realizing they do have this experience. It's a training fellowship. They have this like baseline level to go in, and they have been working on these skill sets. And we really try to emphasize, and I suggest to everybody, like just like Jennifer said, take the time to highlight that and show what your strengths are, and also be very transparent in our written responses during the application cycle. You can also elaborate on what your hopes are to gain from this training opportunity, where it is that you want to grow, right? Like we want to see what your vision is and how you want to explore and expand within global health as well. So really being mindful of that, taking the time to focus on what your strengths are and where you are wanting to learn within it, and highlighting that whole thing within your application.
Great. I think that one of the questions, another question more focused on professional development and what the programs offer, and how the programs are structured to help provide professional development. So maybe we'll go Natasha first there.
Great, thank you. So multiple ways. So not only is, it's a training fellowship in itself, right? So just being a part of it, and every day just kind of, being able to have this experience within the teams is a great learning opportunity. But within the program itself, we have all fellows meet with their mentors at the start of the fellowship year, and they create a goals and objective framework and an individual professional development plan. So what this means, and to not go into the extreme, training detail of it that fellows get during their orientation, but in short, it is a opportunity to look at your fellowship assignment and your scope of work that you will be working on for that year, and to be mindful about what are your main objectives throughout it, how do you have measurable goals with it, and then based off of that, knowing what you have to work on, what are your current skill sets, and what may you need assistance with, right? And that's where your training and certain professional development comes in hand. So they may say like, we know you're going to be working on this big project. Why don't I have you sign up for this particular data course to help you better prepare for it when it comes? Or take this language course. That way, when you go into these countries, you feel more confident in having these conversations with everyone there. So that's just like a short example of it. But in the beginning of the year, you really take the time to plan out your goals and objectives and your professional development plan for the year. And then you meet with your mentors at minimum quarterly to kind of check on your status with it and see if you have to adjust your objectives and then the trainings along with it. So of course, we recommend fellows meet with their mentors. They usually meet weekly or every other week. And, they're just constantly revisiting this. It's a work in progress document, right? That's continuously revisited throughout the fellowship year. And so that's one of the main insights with it. And again, in our fellowship program, fellows receive a travel training allowance. So this helps them go to different countries for different site visits, and also opportunities to sign up for particular professional development opportunities that they need as well.
Jennifer, your thoughts?
Sure. So on the for the STAR program, we do have learning part of the program for individual professional development. The fellows do an individual learning plan with our learning team. They have up to 10% dedicated time that they can use towards learning, and some funds to help with, let's say there's a course or training or conference that they'd like to attend. This money can be used towards that kind of learning, those kind of learning activities. The internships also we have, I think, not sure how frequent they do them, but they have fireside chats where they bring different speakers on different topics that the interns can participate, as well as the fellows, which is also a great way for them to network. But there is some budget also for the interns where they can use the money, let's say, to go to a conference or pay for a course or something to that effect. But there is definitely time dedicated to learning that we provide for the participants, both fellows and interns.
I'd have to say from the PHI CDC program that this is probably one of the things that has been very affected by COVID this year. In that many of our fellows have said that they can get the online courses and get the content, or do the online conferences, which everyone's doing, like this one. But they're missing out on those networking opportunities when you're in person, and when you're early in a fellowship. When you're early in your career, those kind of networking opportunities really are very important. And so, though their professional development has been, continues to be focused within the program and supported, this year it's been very, very content oriented. So that is probably something that they keep telling us that that they probably have missed out in this fellowship year, is those in-person trainings and conferences that they get supported to go through during the year. It's just not the same thing virtually. So we're hearing a lot of that, I think. So hopefully by fall, we'll start back next year, and the next year's program will be back to our more normal kind of professional development and training. Though I think that's probably somewhat of a change that's occurred, just like teleworking. There'll be more and more of these type of virtual meetings and trainings also, but it'll still be important, I think, to have those in-person opportunities, especially for young fellows,
right?
Newly starting their careers.
I do agree. I will say, though I 100% agree, and I heard that with all of our fellows when I conducted, check-in calls with them, definitely missing that in-person feel. And it's a lot harder, virtually, especially when majority of the time cameras are off. So it's, even harder to feel like that person connection and networking. With this, and not saying it's a guaranteed for all new fellows who would eventually join the program, but there was still a lot of unique training opportunities that fellows ended up gaining insight on, maybe not necessarily the courses or that networking, but just being able to participate in various COVID details. And I think there's some podcasts and vlogs on our page as well, if anyone was interested to hear what that was like for some of our fellows who participated in that. But, within this whole thing, they had like that firsthand experience of to see, how is the pandemic handled, right? Like, how is it like to participate on a detail with the International Task Force, and just kind of like hearing all these and being able to communicate with all these various teams as well. So even though it was all virtual, right? It was all virtual. They still had ability to kind of, many of our fellows still had ability to kind of network within that and learn more. So it was a great,
when I've talked to them, the one thing they've said about what they missed was the in-person trainings and conferences.
Right.
One thing they said about what was a great opportunity of the year because of COVID is they were directly involved in their fellowship opportunity. May not have been related to COVID at all, but they were allowed to be on detail to work emergency operations. And in that way, we're networked much more widely at CDC than they would have in their, what would have been their defined fellowship program. So there are pros and cons.
Pros and cons.
Pros and
but
cons.
Definitely, I think majority of us are all waiting to, you know, travel and just start meeting people in person again. So, yes, I agree. Definitely a different training experience.
Have you been seeing that in Jennifer and STAR program too?
Definitely the in-person. I think the interns, I think, got a lot more when we used to have trainings. They would come in, I think, every couple of weeks or so to do some training all together, and it was a great way for them to network as well. And I don't think we have that anymore. We just do the fireside chat, but that it does help because it allows our overseas fellows to also participate. So in some ways, we've kind of always done some form of virtual training, or which has been helpful because of then it covers everybody else who's around the world to some extent. But I think the interns really did enjoy the in-person trainings.
Yeah.
And that's a huge miss.
I think it means more earlier in careers, you know.
Mm-hmm.
Yeah. I don't think we have any more questions that I can see. Natasha, Abdul, Jennifer, anything you want to wrap up and say, or if there are any more questions? Do you see any, Natasha?
I think there was one. There was one question that I see that says, like, what happens if your school is not a member? And I'm thinking that's for our program, since it's from CEPH accredited schools and institutions.
Right.
Unfortunately, it is pretty strict with that. That means that you're not, you know, eligible to apply, but I would double check with your school and program and make sure, you know, there were a lot of institutions, like, so from candidates this past year that had reached out to the program where their university was in the process of obtaining their accreditation. And so I think it's going to be cleared by the next year's cycle. So just checking in with your institution to see if they are on that list. And that's one of the benefits of, you know, once you graduate, you're eligible to apply for up to 5 years, right? So it's for recent graduates, you do have a good window of when you can apply.
Yeah, and a number of programs that I didn't realize and they're not all in the United States. For example, I did a opportunity session with the University of Haifa this year, and by the end of it, realized that they were accredited. So you really need to talk to your school about that and where they are in that process, because it could be in process at the time, or they could have it and they're just not. They're not really on the list, which has happened with us also.
Mm-hmm.
And we don't require membership on the staff program.
Right.
You can be an individual and apply.
Right. Which I think was like another question as well. So there's lots of programs in global health, right? And that's what we, you know, share. So I'm really happy that, you know, STAR was able to be here and present theirs as well. So ours does have very narrow range of eligibility, but as you can see, there are a lot of other programs that.
And actually, that's a good point too, from CDC standpoint, maybe from USAID also, but from CDC standpoint, the EIS program opened with the question on the EIS program, but there are actually many fellowship programs at CDC for health economists, as an example, for monitoring and evaluation PhDs. There's at least 7 or 8 programs that are fellowship programs that you can apply for. Also, EIS is open to foreign nationals through what they call the Visiting Scientist Program. So you should look at the CDC website and look at their fellowship programs also, if you have interest in looking at a variety of different programs.
Perfect.
Did Vic come back on?
Let's see.
Well, I think we can wrap up here. I just wanted to say that and mention this has been recorded. It will be posted on the CUGH conference webpage. So If you want to have anybody you know that would like to take a look at it or go back to it, then we can just refer them to the CUGH conference webpage, and they should be able to see this program in its entirety. Thank you for the panelists. Thank you for everyone participating, and I think that will end the session here. Thanks, Jennifer, Abdul, Natasha.
Thank you.
Thank you.